When COVID hit us in the UK, BARDOC stepped up to try and assist the healthcare system with the increased number of deaths that were taking place all across the UK. We had an increased number of deaths than we would normally expect at that time of year. That increased number resulted in a lot more paperwork. So this is the mandatory paperwork generated when somebody passes away. It includes things like the verification of the fact of death, the death certificates, and then cremation paperwork if that's what's needed in that case. To try and free up time of other healthcare professionals that were working on the front line, we set up a service dedicated to completing these checks and those bits of paperwork. We ran 24/7 out of our call centre, where we were taking calls directly from healthcare professionals and members of the public. This was once somebody had passed away, so we'd get a phone call asking us to confirm and verify the fact of death and then assist with the paperwork afterwards. The service ran across spring and summer of 2020. We helped hundreds and hundreds of families expedite bits of paperwork and also relieve some of the pressures that other healthcare professionals in the system were facing at the time. Another example of how BARDOC works in a very reactive manner to crisis across Greater Manchester and sometimes nationally was back in September 2021. You may recall the efforts to bring over Afghan refugees that were being displaced after all the atrocities that were taking place in Afghanistan. They were being airlifted to safety, and many were brought over here to our local airport, Manchester Airport, and we were receiving them at Terminal 3. Over a very intense 5-day period, we quickly assembled a team, and at BARDOC we provided a number of doctors and nurses that went out to assist at the airport. Our job at the time involved coordinating the effort from a clinical perspective, as well as on the ground receiving passengers that were stepping off the plane from Afghanistan and providing immediate healthcare and support. Once patients were deemed medically fit, they were then transported to local areas where they were accommodated by the councils. If somebody was deemed not to be medically fit, we of course made the arrangements for them to get the help they needed at local urgent care centres and hospitals. If you'd like more information on BARDOC or any of the services that we offer, don't hesitate to have a look on our website, which is www.bardoc.co.uk.